Hello, everyone. Thank you for joining us again today. Hi, Sarah. It's nice to meet you. So we are going to start our session this morning. Our theme is love and relationships and cross-cultural differences in responses to COVID-19. And Sarah now is going to kick off the day by telling us how changes in feelings of belonging and connection induced by COVID-19 relate to marginalized groups such as autistic populations. So Sarah, please, you can start whenever you're ready.
Thank you. Okay. So I hope that everybody can see my screen now. Can you see my presentation? Excellent. Yes. Somebody's given me the thumbs up. So I'm really delighted to talk about my research in this really important and under-investigated area of mental health problems and suicidality in autistic people, but thinking about how the pandemic and the situation with COVID-19 is changing the way that our kind of conceptions and understanding of belongingness, and how this might actually make our society more accepting of diversity and actually open up social spaces to previously marginalized groups, such as autistic people. So just a note on language, a recent survey in the UK and in other countries as well asked the autism community what kind of language they prefer to describe themselves. And they used loads and loads of different terms like autistic, Aspie on the spectrum, and person with autism. But on the whole, autistic person was most preferred by the autism community, and person with autism was preferred by professionals. And this is the case in the UK and Australia and the US. So in my presentation, that's the reason that I'm using the term autistic person rather than person with autism, to reflect that most popular choice by the autism community. But I completely realize that there are lots and lots of different preferred terms. I completely respect people's own choice for the language that they use, but this is just the reason that I'm using this language. So I'm not too sure how much people know about autism, so I'm just going to give a little bit of brief background. So autistic people experience difficulties in socialization and communication, and that's required for a diagnosis of autism. But really recent research is actually showing that this kind of difficulty in socialization and communicating with others is actually primarily with non-autistic people, whereas autistic to autistic person interaction and communication is actually really effective and really efficient, and much more efficient compared to autistic to non-autistic people's interactions. So we're now understanding that socialization and communication difficulties in autistic people are actually more a result of their environment and the people that they're interacting with, rather than the person themselves. And that's really, really important. And it's a kind of shift from our previous thinking about how autistic people experience their difficulties. Autistic people also experience sensory hypersensitivity. So that's being really, really sensitive to your environment around you, being really sensitive to noise, to taste, to touch, lighting, that can actually result in a lot of difficulties in accessing social spaces like bright, noisy supermarkets and other public spaces. Autistic people also experience narrow, intense interests, but this isn't necessarily negative, because autistic people can have amazing skills and talents and amass really, really amazing knowledge on key topics, and that can translate to really, really important and useful roles in society, such as Greta Thunberg and Chris Packham are a few examples, but there are very many more. Autistic people, unfortunately, are very likely to experience difficult life experiences and potentially traumatic life experiences as well. So, for example, being much more likely to be homeless, suffer from trauma and abuse, or to be excluded from education. And 79% of autistic people, particularly autistic adults in this case, meet criteria for at least one co-occurring mental health condition at one point in their lifetime, which is really high rate. And they experience misunderstanding by non-autistic people. So non-autistic people find it very difficult to read autistic people's behaviour, and this is associated with them being perceived socially unfavourably. So what about autism and suicidality? In the first study that we ever did on this topic in 2014, which is actually very recently, 66% of newly diagnosed adults with Asperger's syndrome, that's autism without co-occurring intellectual disability, reported suicidal thoughts, and 35% reported lifetime experience of suicide attempts, which is a huge and worrying number. And more recent research has shown that autistic people without co-occurring intellectual disability are 9 times more likely to die by suicide compared to the general population, and the highest risk is in autistic women. Autism diagnosis and autistic traits that are normally distributed in the general population, but aren't necessarily in diagnosed individuals. They explain more variance in suicidality after controlling for risk markers, which suggests that there's something unique about autism and autistic traits that increase risk of suicidality. And undiagnosed autism is overrepresented in clinical samples. So in 11% of depressed patients and 15% of patients with borderline personality disorder, they met criteria for diagnosis of co-occurring autism, which is a huge number compared to the 1% rate expected in the general population. And in those with co-occurring autism and depression or borderline personality disorder, they were even more likely to experience suicide attempts in their lifetime than if you only had one diagnosis. And in those who attempt suicide, who don't suspect that they're autistic, don't have family members with autism, aren't diagnosed with autism, 40.6% of them report clinically significant levels of autistic traits, which is a huge number. And in those who die by suicide, autism is also potentially overrepresented. In our study that's in preparation, this is around 11%, but we're finding rates depending on the sampling of up to 41%. So there are a number of counting studies, but there's not enough about why. So we've been doing a lot of work in partnership with autistic people to identify the most important factors that we need to address. And I'm going to be talking about 2 different aspects: risk and protective factors and existing models. So in our research, we have been looking at the interpersonal psychological theory of suicide, and this is what a diagram kind of explaining the different aspects of it. And this was a model developed for the general population, but we feel that it really resonates with autistic people, because a lot of autistic people describe these difficulties in their everyday life, external indicators of this model. So one aspect is thwarted belongingness, which is feeling that you don't have meaningful social connections with others. And autistic people really describe that in their daily lives. And perceived burdensomeness is perceiving yourself, even if that's probably incorrect, being a burden on others. And this is another thing that autistic people can experience as well. And capability for suicide is developed in response to experiencing lots of painful and frightening and potentially traumatic events that we know autistic people do as well. So they could be more at risk of developing all of these aspects, which make them possibly more likely to attempt suicide. And we've done quite a few studies testing this model in autistic and non-autistic people. And we find that these predictions hold up in autistic people, which indicates that thwarted belongingness and making people, autistic people, feel that they belong is a really important factor in preventing suicide in that group, and also in the general population as well, and young people. So what do we know about social belonging in autistic people and non-autistic people? Because this is actually applicable to everybody, not just those with autism. Social belonging is a basic human need, and it protects against mental health problems and even thoughts of ending life. And there's really strong evidence to suggest that, both in autistic and non-autistic people. But previous research has really unhelpfully assumed that autistic people are not socially motivated and have just ignored belonging and similar constructs in relation to them. But research shows that this assumption just isn't true. And we know that because belonging is an important part of autistic people's well-being. They spontaneously refer to it when they talk about their well-being. Feeling accepted is important for good mental health of autistic people, and they report that in studies. Belonging protects against mental health problems and thoughts of ending life in both autistic and non-autistic people, according to our research. Whereas camouflaging autistic traits, we found increases feelings of not being accepted, feelings of thwarted belongingness, and consequently suicidality across 2 studies. And this is true for both autistic and non-autistic people. So what does social belonging look like in autistic people? Is it different? Is it the same? This is an example of the questions used in a measure of assessing social belonging in the general population. It includes items like, these days I feel like I belong, these days I'm fortunate to have many caring and supportive friends. And we actually compared how autistic and non-autistic people responded to these questions using focus groups, and also a technique called measurement invariance analysis that statistically compares the structure of a tool between 2 different groups. And we found that autistic people and non-autistic people responded similarly to many questions, specifically the first 3, but the second 2 at the end here, these days I'm close to other people and these days I often feel like an outsider at social gatherings, were different. And that indicates that autistic people interpret and respond to these questions differently to non-autistic people. So this suggests that there are many similarities in autistic people's experiences of belonging, social belonging, compared to non-autistic people, but there's some possible subtle differences in how autistic people prefer to connect. So it might not involve being with loads and loads of people, for instance. So social belonging in autistic people, autistic and non-autistic people, as I said at the beginning, have different communication styles and preferences. And a recent theory called the double empathy problem postulates that 2 people of very, very different neurotypes, very different ways of connecting and communicating with one another, will have difficulty, each will have difficulty empathizing with the other. And I presented some evidence at the beginning that suggests that that's the case. And we really need to close that empathy gap. So in summary, social belonging is important for the mental health of both autistic and non-autistic people. Social belonging looks similar in autistic and non-autistic people, but there are some subtle differences, and that may lead to misunderstanding and lack of empathy between those groups. Autistic people report many barriers to accessing social spaces and feeling othered, which impacts their mental health, well-being, and risk of suicidality. So we really need to close that empathy gap between non-autistic and autistic people. So what can we do? We need to stay connected. We're moving into the virtual space. We're having this conference virtually. I'm having all my meetings virtually. I'm sure you are as well. One-to-one group meetings over video, audio, or text chat. We need to keep appointments and meetups, but move them into the virtual world. And schedule regular virtual social events. Sending people a nice message over email, text, and social media can be really helpful. And we have an opportunity to make our own positive and safe spaces online. So what does this mean now? From the evidence that I've presented, we definitely shouldn't assume that social distancing in the current pandemic will not affect autistic people. It could. How is the current pandemic affecting us? We might feel confined and isolated. Lots of things are cancelled and support may be unavailable or different. But although we have to be physically distant, I'd argue that we don't have to be socially distant. So I think it's important to think about the opportunities and not just the difficulties. There's a lot of change and uncertainty, stress, frustration and disappointment. But on the other hand, the pandemic is forcing society to redefine what social belonging means and how we can stay connected. And this time could be an opportunity to influence this and change the narrative and open up new ways of creating and opening up social spaces to everybody. And I've been wondering if this could actually close the empathy gap, because on my Zoom meetings, I'm finding it really, really difficult to know when I'm not interrupting somebody. I feel quite stressed to know when it's my turn to take my turn in a conversation, or to manage an interaction with lots of different people as kind of blocks and squares on my screen. And I'm finding that my autistic friends and colleagues and steering group members are saying that this is what it's like for them every day. So I'm getting a unique insight as a non-autistic person, what it is, perhaps in a small way, to have some of the difficulties that autistic people experience. So could that make us more empathetic? So what's happening right now? So autistic people have been asking for years for alternative ways to access social spaces. They've been asking for online and virtual teaching and assessment. They've been asking for alternatives for face-to-face treatment and support, not over the phone, which can be really, really stressful, but text and online ways of interacting. And this is now having to happen worldwide really, really quickly. The impossible has shown to be possible, because we've been told for years that this wasn't possible to do, but now we're having to do it for everybody now that everybody needs it and not just a minority. So I think it's really important that we keep this learning and shift going, because it could benefit everybody. So thank you all very much for listening. Stay safe and be kind to each other. And if you've got any views or questions, then you can always email me. Check out my website and my Twitter. Thank you very much.
Thank you very much, Sarah. Let me, okay, close this. Very interesting talk. And it's great that you brought it up, because we mostly focus on the general population, and we tend to forget sensitive groups, people with autism part of it. And it's kind of unfortunate that we have to put ourselves now in a situation of isolation and distancing to see that we have to look at alternative methods to communicate with others, whereas these groups have been asking for these alternative ways of communication for some time now, and they haven't had the opportunity to do so. But hopefully this will change, like you mentioned now, and we'll see different things. There was also a point by Kerry Gould on empathy that you spoke about before, saying that there's a misconception of empathy. There's emotional and cognitive empathy, and ASD have normal emotional empathy, not so much psychopaths, but weaker cognitive empathy, which is very good in psychopaths. Do you have anything to add on this apart from what you talked about?
Yeah, absolutely. The research that they're referring to, yes, absolutely. There are two kind of postulated different components of empathy. And the difference is in autistic people, historically, they were kind of mislabeled as lacking empathy, but actually it's more understanding another person's point of view that's the difficulty. So if you explain to an autistic person that you've hurt somebody's feelings, then they would feel really, really terrible about that. They would have an empathetic reaction to that, but it might be difficult to predict how other people will react, or how their mind works, or how their view might differ. So that's quite an important difference, yes. But in terms of the research that I was talking about, the double empathy problem is a very, very different point of view. So with that kind of cognitive and affective empathy research, a key tenet or kind of positionality about that was assuming that there was something wrong or something different or abnormal or deficient in the autistic person. So the difficulty was located inside the autistic person. Whereas with the double empathy problem, it's postulating that that empathy difficulty goes both ways. So in whatever way that autistic people, cognitive or affective, have difficulty in empathizing with a non-autistic person, that difficulty also resides in non-autistic people when empathizing with autistic people. So that empathy difficulty goes both ways, and therefore the difficulty in empathy is not located just in the autistic person, but in the interpersonal space between autistic and non-autistic people. So instead of thinking of autistic people as deficient or defective or impaired in any aspect of empathy, it's more moving that kind of positionality into the interpersonal space and into the environment of the autistic person interacting with other people.
Right.
May I ask a question, Donna?
Thank you very much. I was wondering, have you done any survey these past 2 months with autistic people to check on their feelings? This is not my background. I do not know much about it. Or do you have any data?
A really, really important question. And I've been grappling with this because I was doing a study that was going on, and we're just starting to recruit just before lockdown happened. And it was looking at patterns of self-harm in autistic adults. And I have a steering group of autistic adults who've partnered with me in this study. And we had a meeting and we discussed, is it ethical to continue to do this at the moment? And I've actually written an article that's a commentary with Professor Ellen Townsend and Emma Nielsen that's published in Lancet Psychiatry on key ethical issues for COVID-19 research at the moment. And we collectively decided that now wasn't the time with such a kind of vulnerable group to be asking questions about entrapment, about self-harm, when available supports had kind of closed temporarily, when they were different, when autistic people who have difficulties in coping with change had to make a massive change to everything that they did in their life. So for that reason, we've closed down all of our self-harm and suicidality research studies over the past few months. Now that things are starting to open and support is starting to open again, we're considering relaunching our studies, but that will involve careful consultation with autistic people to ensure that it's safe and that people are supported.
All right, sure. Yeah, understood. And very good point. Perfect. Thank you very much, Sarah, for joining us today for your very interesting talk, and looking forward to hearing more from you in the future and the research you're doing.
Thank you.